hand hygiene. Hi, Mr. Smith. My name's Kylie. I'm going to be your nurse today. I'm here to change the dressing on your central venous catheter insertion on your chest. Have you had this dressing change done before? You have? Okay, perfect. Do you have any questions or concerns for me about this dressing change today? No questions? All right. So to get started, if you could just hand me your wrist so I can look at your wristband. And what's your name and date of birth? All right, everything matches. John Smith, January 1st, 1970. And Mr. Smith, do you have any allergies? Are you allergic to chlorhexidine? No allergies, you're not allergic to chlorhexidine? Okay, perfect. And are you having any pain today? No pain, all right. So we are good to start. First, I just want to make sure you are in the optimal position for me to do the dressing change. I see you're already sitting upright, so that position will work for me. Are you comfortable here? You are? Okay, perfect. The second position change I need to do is I'm going to ask that you face the left side of the room towards the wall. So if you could just turn your head now. All right, thank you, Mr. Smith. I will let you know once you can turn your head facing forward again. And I'm going to go ahead and get started on prepping my workspace. So I'm going to do more hand hygiene. I'm going to put on a pair of gloves. I'm going to take a Clorox wipe and wipe down my table, making sure to cover the table completely for 30 seconds. I'm also going to get the edges around the table. All right, so it's been 30 seconds. I'm now going to let the table sit wet for a total of 2 minutes. This is in order to allow the solution to kill any bacteria on the table and also to allow it to dry. I'm going to do hand hygiene. All right, and now that it's been 2 minutes of the table sitting here, I'm going to go ahead and grab my supplies. So first I have my bio patch. I have an extra pair of sterile gloves just in case I need them. And I have my central venous catheter dressing change tray, which I'm going to go ahead and open up. And then since I've done hand hygiene, I can go ahead and grab the sterile gloves out of the packaging, just touching this outside paper. And then I'm also going to grab the mask inside of the tray since both my patient and I already have a mask. Next, I'm going to take the bio patch and open it up and place it into the tray. I'm going to do hand hygiene again and put on another pair of gloves. And I'm going to go ahead and remove the dressing on the patient. Before I do so, I'm going to make sure that the tubing is clamped to avoid an air embolism. All right, Mr. Smith, I'm going to start removing the dressing now. Please let me know if you have any discomfort while I'm removing it. So I'm going to start by removing the taping that has secured the tubing. And then I'm going to start removing the tegaderm itself. Making sure to be gentle on the patient and not press on the insertion site. And as I get closer to the insertion site, I'm just making sure to stabilize the tubing with my left hand. And then I'm going to remove the bio patch. Are you doing all right, Mr. Smith? All right. And then now that the site is exposed, I'm going to go ahead and do an assessment. So first I'm going to check for any signs of infection. I don't see any redness, no swelling, no drainage, and no bleeding. So there's no signs of infection. I'm also going to assess the tubing to make sure that there's no damage to it, no leakage or breaking, which I do not see any of the above, so the tubing's all right. And then I'm going to go ahead and measure the tubing to make sure that the tube itself has not migrated since the last assessment. And according to my measurement, it is the same as last time, so the tubing is still in the correct position and place. So now I'm going to go ahead and take off my gloves, do hand hygiene. I'm going to go ahead and put on my sterile gloves. I'm going to start with my right dominant hand. And then I'm going to go under the cuff of the other glove to put onto my left hand. And now that both gloves are on, I can go ahead and just touch the outside to fix it up. All right. So my sterile gloves are on. I'm going to go ahead and grab the center of the paper that is sterile and just move it to the side while keeping my hands above my waist. I'm going to move the tray closer into my reach. And since both my hands are sterile, I can go ahead and put both in there to prep my tegaderm just by folding the back to make it easier when I need to open it up. Next, I'm going to grab the ChloraPrep. I'm going to crack it to get the chlorhexidine to the end of the tube. And now I'm going to start cleaning the site. Mr. Smith, I'm going to start cleaning around the site. Please let me know if you experience any discomfort throughout this process. So my left hand is going to be used to hold the tubing, and my right hand is going to remain sterile and clean. I'm going to clean a 2-inch border around the insertion site. All right, so now that I've cleaned a 2-inch border around the site, I'm going to clean the tubing itself, going all the way up on all 4 sides. And now I'm going to let the tubing dry as well as the skin for 30 seconds. All right, so it's been 30 seconds. I'm going to place the tubing down. I'm going to dispose of my chlorhexidine while keeping my hands above my waist. I'm going to go into my tray with my right clean hand and grab my bio patch. I'm going to hold the tubing while I place the bio patch. I'm going to go back into the tray with my right hand to grab the tegaderm, and I'm going to use my left hand to take off the backing of the tegaderm. And then I'm going to place the tegaderm over the insertion site. And now that the bio patch is covered, I can go ahead and use both hands to get any air bubbles out. Are you doing all right, Mr. Smith? Okay, perfect. I'm almost done on my end. So now I'm going to take off this white border around the tegaderm. And there's a sticker on here that I will write my the date and the time I did the dressing change, as well as my initials. And I will place it near the central venous catheter insertion so the next nurse knows when the last dressing change was. Next, I'm going to grab my tape. I'm going to use the tape to secure the tubing on the patient's chest. Just to make sure that that tubing doesn't move around and bother the patient. And now I'm going to clean up my site. Getting rid of the materials that I did not use. I'm going to take off my gloves, do hand hygiene. All right, Mr. Smith, I have finished the dressing change if you want to go ahead and face forward once again. And how was that dressing change for you? Did you have any discomfort or pain while I was doing the dressing change? No, none at all? Okay, perfect. So I just need to document the assessment and the steps that I just did, and then I'll be out of your way. Okay, so I'm going to document the date and the time that I changed the dressing, as well as my assessment of the site, that there was no signs of infection, no swelling, no redness, no drainage, no bleeding. Also, my assessment of the tubing not having any cracks and not having migrated. I'm also going to document that the patient was able to tolerate the procedure without any pain or discomfort. And that finishes my documentation. All right, Mr. Smith, I have finished documenting the dressing change I just did. I'm going to go ahead and head out, but if you need my help, just use your call light. Thank you.